Hey everyone, it's Lisa with Hope for SCD, and I'm here with my last therapeutic trial. Tomorrow we're going to move on to drug trials, and I thought I'd end this one on a happy note, and it's umbilical cord collection. This actually came up during my pregnancy after Sophia, and I wondered about how much it costs to store cord blood and whatnot, and if there are any programs for people with chronic illness. And at the time, it wasn't really clear that there might possibly be, and so this is really exciting. This is based out of Maryland through the National Health, Lung, and Blood Institute, but they're actually having people do it all around the country. Just work with your doctor or midwife to participate in this trial. I use that term loosely because it won't feel like a trial once I explain it. All right, the people that can participate are pregnant women between the ages of 18 and 45 who are at risk of having an SS baby only. So if you and your partner both have the sickle cell trait, then you would qualify. The caveat is they're not looking for SC or S beta 0, any of those. This is just SS for this one. You might contact the investigator just to clarify, but that's exactly what it said on the clinicaltrials.gov information, that they were looking for sickle cell SS. So if you are at risk, meaning that both you and your partner have the sickle cell trait, then you can qualify for this study during your pregnancy. It doesn't matter what number pregnancy, it could be your first pregnancy or your 10th pregnancy. And the exclusions are if you're positive for a transmittable disease, which would be something like hepatitis B or HIV, then you're excluded from that. The objective is to obtain umbilical cord blood from newborns at risk of sickle cell. They are also collecting sibling blood. So if your baby is at risk and then they're diagnosed with just the trait, or they're diagnosed as completely healthy AA blood, they will also store that as well. So here's how it works. They've made a huge push in America to really explain how useful cord blood is. We've seen it work amazing wonders in both the cancer world and recently in the sickle cell world, being able to help cure people. So they're looking at getting the cord blood from those babies that are at risk, and then depending on if they were diagnosed with SS, they'll save your cord blood forever for future use. And if they're diagnosed with the trait or as healthy, then they'll save that cord blood for up to 3 years to be used for siblings. And so here's the how. It's very simple. You're in labor. You give birth, and after your beautiful, healthy baby comes out, I've actually had this done, where they take the cord blood, so they let the baby stay connected to the placenta a little bit longer, and then when they cut that umbilical cord, the cord blood kind of pumps out, so they just collect it, and then they get, in this one, they're going to get a little bit of sample of the placenta as well, and then they refrigerate it, and National Heart, Lung, and Blood Institute collaborators have a connection with your doctor or midwife on how it gets mailed out to their storage facility. If your baby is found to have sickle cell disease, SS, the study kind of continues on in that they will call for health updates 2 times a year indefinitely. The contact is Winona Coles, and that's 301-402-2104. And we're going to end on a high note. Stay tuned as we progress into all of those new drugs that might actually help us in the world of sickle cell disease. Thanks. Bye.